Hello. Good morning. I'm Dr. Anya Griffin, and I have the pleasure of being here with Dr. Leora Kuttner. I welcome everyone to the CHIP webinar. We're excited to be here with you. I am Dr. Griffin. I am a pediatric psychologist and the director of psychology at Children's Hospital Los Angeles. And I've had the pleasure of being involved with CHIP almost since the beginning. I love CHIP. It's a wonderful organization. And I really enjoy the work that CHIP does for young people. And my specialty area is working with young people who have chronic pain conditions, a variety of chronic pain conditions. So I think of this as a home away from home. And my background is that I specialize in hypnosis for pain healing and management. And I utilize dance movement therapy and a lot of creative healing therapies and expressive arts therapies to support young people with pain management. And I'm going to introduce my mentor, Dr. Leora Kuttner, and I'm going to let her tell us more about herself. But this is a luminary in the field and has been doing this work with young people for a long time and has really, I believe, set the bar for the kind of work that we should be doing in helping young people with pain. So, Dr. Kuttner, please introduce yourself. And I'm excited that you and I will get to have a conversation about pain and creativity and healing.
Oh, I'm so looking forward to this lovely opportunity. Thank you. Thank you, Dr. Griffin. And thank you to Chip and to Dr. Zeltzer, who has been my colleague and friend for many, many years and influenced my own direction. So it's lovely how there's this interchange and supportive community influencing and supporting one another. So, I am a pediatric clinical psychologist with a foreign accent. And I was born in England, and I've spent years in many countries like US and South Africa and England I came to Canada in 1980 and I realized that pain was very badly managed in our oncology unit. And at that time, I was trained in hypnosis and wanted to bring hypnosis into the oncology practice here in Vancouver, Canada. So that's where I am still to this day, 46 years later. And so I established the very first pain and anxiety management program in a hospital in the cancer unit, and then went on as the years and medication improved and systems improved to work in chronic pain, just like Dr. Griffin, and became fascinated about how we mustn't be in silos. We mustn't have these separate compartments. And that's why I'm thrilled and honored to be part of CHIP today, because the integration of creativity, of imagination, of movement, of joy, of hope is essential in healing. And so when Dr. Zeltzer asked us to talk, we thought we could have a rich conversation about hypnosis and movement and how they intersect. And I should just add that for the last many years, I'm a professor in the Department of Pediatrics at UBC, Vancouver, Canada. But prior to that, I was a professional filmmaker. So at some point, a little into our conversation, Anya, I would
Yes.
very much love to show a short clip from a film that I made that deals with this topic about the confusion and the movement that's needed and the creativity and the creation of hope that is
Yes.
essential for chronic pain healing. So,
That's that's honestly my first question for you, Dr. Kuttner, is, this beautiful use of storytelling and film about young people, children, teenagers who are navigating, the difficulties and the healing process of living life with pain. Why is it so important for young people's stories and their lived experience with pain to be seen and heard?
it's because that's who we are. We are meaning-making beings, and we make meaning through figuring things out and making a narrative. Stories emerge from our experiences, and those stories live on.
Mhm.
And those stories can be very helpful, or they can have a sting in their tail and hold us back. So the stories we tell ourselves or the stories we create through our experiences need to be examined in terms of ensuring they're supporting us in the proper way to go forward into the possibilities that are given to us so that change can happen. And so stories are truly who we are. And that's why hearing one another's stories, writing down your stories and seeing where you got stuck and you go over and over, not letting go of something or
Yeah.
holding on to a hurt that
Mhm.
hurt, but is in fact in the past, but is being dragged into the present and it isn't serving a helpful
Mhm.
purpose. And part of the creativity of storytelling and healing is to look at the story and edit it, take that
Mhm.
red pen or the delete button and change it so that it can come alive and feed you. Stories need to nourish us, not bring us down.
Yeah. I think
What
so much, what you've said reminds me so much of a particular story that I hear so many patients talk about, and it's that they've gone to so many doctors and they've heard this statement of this pain is all in your head and how important it is, to tell the story of what their journey has been in order to move to a place of healing. And so much of what you just described, I think about in the work that we do in helping young people to learn self-hypnosis. And
yeah,
that, there's so much of telling one story. And I really like this statement you said about using the delete button and editing things so that how we're experiencing something that we begin to actually have some empowerment, like our own power to be able to take the story and shift it and change it. Because, like you said, we're meaning making beings. That's our natural human experience. And being able to shift and change the story or take on the story and make it your own in the way that you'd like it to be or that you'd
so,
like to experience
so
it.
and tell me, what do you find then? are some of the best ways to re-story the story, to bring hope into it?
Yeah. One of the most one of the most amazing experiences I've had in my career was using photography with young
Yes.
people when I was working at Stanford in the pain rehabilitation program. And one of the things I asked young people that I was working with who were really dealing with very, very difficult pain experiences, and had gone through so many things, surgeries, medicine, so many different things, physical therapy. All these things are wonderful, wonderful treatments and resources. But, nothing was really making a difference. And so we have to do this a different kind of way of having a big team coming together. And what we did at the beginning of them coming into the program was have them take a photo to describe their experience of pain, what their own lived experiences of pain, and then to tell the story of what that picture means. They say one picture is worth 1,000 words, and I just wanted to hear what the story was for them. So, we took the photos and then would record and understand the words of the story, and we did that at the beginning, and then we went through treatment. And at the end of treatment, they would take the picture again, a different picture, to then describe what their experience was after they've gone through the treatment program. And there were these beautiful, beautiful images that patients of mine would create. And it it really, I think, became part of a treatment of
Beautiful.
taking a photo, telling their story, being
Yeah.
able to say what the meaning was for them, and to really be able to find, I think what we saw in the end picture was the hope. I think we saw where the healing, the pieces of hope and healing took place.
And so you and I are passionate about hypnosis.
Mhm,
And so we can go with photos or we can go with the photo in our imagination.
mhm.
And that's what hypnosis offers us.
Yes.
Right? Where we took those photos or we have that story and we can close our eyes and go inside and look and see what that picture is saying and have that be respected. Very important.
Yes. Very
And
important work.
then to have the freedom, and this is the creativity coming in, isn't it? Where you have the freedom to look and say which part is helping me move forward and which part is fear holding me back.
Yes.
And to then navigate and see. You don't have to reject. You can hold both, and then you can ease your way or make choices or color it out or take a
Mhm,
new photo or transform. And so in
mhm.
hypnosis, you can go inside and then say, yeah, that was then. And now, because I'm working with lovely Dr. Griffin, I have more support, or I can
Mhm,
see a way forward, or I have more energy and hope.
mhm.
And I've got the energy now to say, I want a different way. I want a, a more positive way, or I want to use this opportunity to find the way. And so
And change and even change the way
change the
that
way.
we're experiencing certain things, certain sensations, and that comfort could be something. I think one of the things that I found fascinating, especially, one thing I really want to give credit where credit is due is that, I learned all of these amazing things from Dr. Kuttner, about hypnosis. That's who, you trained me in this really remarkable tool, that I think of as more of like a tool that really helps to empower patients on their healing journey. And one of the things is that change is possible. And that comfort is something that could be learned. I always thought of comfort as you have it or you don't. And comfort could actually be learned and changed and shifted, and we can turn the dial to comfort. And I think that that blew me away more than anything else. And I will never forget. There was an experience, Dr. Kuttner, where I tore my hamstring. And I remember you helped me with something one time where, our mind, when we're in pain, like our brain, it's remarkable how our attention just wants to go to the experience of pain. It's an alarm. We're supposed to, like the system says, hey, stop what you're doing. You have to pay attention to this. But and I teach people all these breathing exercises and so many things. And I thought, none of this is working. And I got really frustrated. And one of the things that you helped me with was to identify the teeniest of tiniest attention I could begin to pay to comfort. And I think you called them islands of comfort. You said I
Yes.
might be in this sea of, like the pain and the chaos that I feel like I'm getting tossed around in this ocean that felt like I had no control. And you suggested that I just notice the small little islands of comfort. And at first, the islands are maybe very teeny and far apart from each other, but eventually I would find those islands. They would be easier to find. They would be bigger land pieces of islands until I got to back to land. And I will never forget that because it helped me to really connect to, oh, wait, this breathing exercise might not, quote, take my pain away, but what it does is it gives me a little island of comfort just for a brief moment. And then I keep expanding that and expanding that. And that's where I realized I could actually change something.
Oh, that's so good. That's so important. I'm thrilled to hear that you've held on to that. And
Yeah.
you're so right, because when we feed those little islands of comfort, they grow.
Yes.
Whatever you feed grows. And
Hmm.
then they grow together and they become a really good landing place
Yes.
to hold you, and you feed it and it grows and you feed it with attention. And that's the hypnosis piece. What
Yes.
you give your attention to expands and
Hmm.
becomes central to your brain and your pain. Well, it's, of course, your brain processes pain. If it weren't for your brain, you wouldn't feel any pain. So we do need to work with the brain. The brain is the boss of the pain. I think this might be a good point for
Yeah.
us to show this little clip. Do you think?
Yeah. This is a perfect point. Yes.
Okay, let me introduce it. So, um, this is a little section. It's about 3.5 minutes from a 20-minute film about four teenagers with very different chronic pain problems for many years, and they are from different parts of Canada, and they're talking about their journey, and their journey is a dance with pain. So, as anybody knows who's had chronic pain, and me included, you absolutely have to learn how to navigate and and not fight your pain, but work with it to down ramp it. And so I use the dancer in this film to express what these teens are going through. And so let's show it.
Very, very, I'm not dealing with this. I don't want to see a physiotherapist. I had post-op complications, and those dragged on.
And in some ways, I felt I was worse after my surgery than I was before my surgery, and I was devastated. And then I hit a wall. Instead of getting better, things were getting worse.
No one understands me. That's one of the blanket statements you make. But it's like, I can't think that, because you know what? There are some people, yeah, they don't get my pain that I'm in, right? Because pain is, unique for yourself, and it's unique for me. But, they try to understand, and there are people that care about me. And I think that's what kind of changes it. Because all of a sudden, I had this group of people that were willing to advocate for me, and they believed everything I said.
Uh-oh. Uh-oh. Can we jump that,
Apologies.
please?
Yeah.
This is not fun. Thank you.
What I've learned in the process over 10 plus years of dealing with this is that your mind is a very powerful tool.
We got referred to the pain clinic, and I think that's like, I guess in the whole story, that's kind of like the changing point where everything kind of flipped around.
At that point, I couldn't go on like this anymore. And that is when I went for help with pain management. And I learned self-hypnosis and breathing techniques and body scanning techniques. And that is what saved me. That's what allowed me to get through the rest of my recovery. That was a big changing point for me. I found hope again through that.
Visualization is a huge one for me. I use visualization all the time. Imagine it's like you have an elevator in your brain. And so it's like, first I hit the first floor, so, relax my legs. Second floor, third floor, and then until it gets to that place. And, I know the pain is there, but it's like I compressed it, put it in a box, and threw it to the back of my head, right?
When the pain is sharp and coming on repeatedly, you kind of take deep breaths, just or slow, calm breaths. In a way, you're actually sort of, I suppose, breathing out the pain.
One of my favorite pain control, as well as combining exercise, is to go sit in my hot tub at home. Because I get the heat, I'm able to get much more exercises done than I would outside of the hot tub. I really like to have both limbs forward, say we're doing a quad exercise, so that I'm viewing my good leg and my bad leg side by side. I'm able to visualize normal function, and I cognizantly think of that so I can see it going through my leg. I find if I were just to focus on my affected limb, I'm just going to be seeing the pain that's there.
I use distraction, I write music, I draw pictures, I decide to do my homework or something. Regular stuff. When I'm writing, I just think about the music I write. I think about the words, the flow, the delivery. When I'm wrapped up in this process, I'm here. I'm in the music, not in my body where the pain is.
Thank you.
I have a mind.
Thank you. We can stop there. I think that gives a really good statement about how essential creativity is. For Keston, he used music, song creativity. And as he said, he was in the music, not in his pain. And that is an active choice we all can make. And when we use hypnosis, we can choose to be in that alternate state of comfort, those islands of calm, or, with a beloved family member, having fun, or just being soothed.
Right.
And there are endless possibilities. But we are complex beings, and that's why I love that diagram so much, Dr. Griffin. That one that showed the body self neuromatrix and all the input of thought, feelings, body sensation creates who we are, and then we have different options of how
Yeah.
we express it. And if we get stuck in the pain, then it's just, but there are options all the time. So we can go with different kinds of movement
Yes.
that eases the
Hmm.
pain. And
Hmm.
um, and we sometimes need to sit with our bodies or move into our bodies to feel what helps the most. And that's where the mind and the body connect into that neuromatrix where you can be creative and figure it out. Do I need to twist this way? Do I need music to give me a little bit more lightness? Do I want to just breathe the pain out, like one of the teens said in the film? Yeah. What are your thoughts?
My thought is, thinking about the islands of comfort. There's lots of different ways to get to these little islands, even creating the islands of comfort. And I think about this term that we hear people say a lot, like creative problem solving. And I really appreciated hearing the young man describing his use of writing music. It can be lots of different ways. We've talking about self-hypnosis, and I think that self-hypnosis comes into play a lot with creativity. So if we're dancing, or watching something really funny, or like a really funny clip or a funny movie, when we're in these moments of, really getting ourselves drawn all the way into painting or drawing, or if we're singing, or even I can't sing, but I can hum. Humming, there's research that says that humming helps to wind down our nervous system. And I think that winding down the nervous system is such a critical component of healing from chronic pain. Because when we have pain, the nervous system is really, I think of it as like a tornado that has wound itself up. And how do we begin to unwind that tornado and see, sometimes even talk about seeing it as it, like visualizing it and seeing it as this big tornado. What's it made out of? What color is it? What, the debris that's sort of flying around, and then taking, sometimes I'll even take my own breathing to wind that spinning down and letting all of that debris come settle back down. And we used to do this in so many ways. Like we'd make these glitter jars and put all this glitter in a jar, and sort of some clear glue and some water, and keep stirring it until everything kind of dissolves, works its way in together. And then, putting the top on, and then shaking it and watching the glitter spinning around, and then watching just as the glitter gently begins to float down until it settles all the way back down. And there's something about just that mindfulness experience of watching the glitter float down. But I'm mentioning all these different things because there are so many different ways that we can do this. And I say creative problem solving because it depends on the person and what may be of interest to them. I mean, I've even had kids using scarves and putting them in a big blue body sock and moving around, and our brain begins to process these experiences differently. And we really start to
That's the neuro.
reprogram like how the brain is processing the experience of pain,
Exactly.
and can start to make new pathways, new neural pathways, so
And
that the brain actually does then begin to see it differently and experience it differently.
that's the repatterning. I want to pick up that point you made earlier. I love it because I actually read this research about humming. And so humming uses breath. And humming is created through the nose. And you know what it does? It creates nitric oxide,
Mhm.
which is a relaxant on the
Yes.
nervous system. And so that tornado will quickly start being contained and brought down and soothed, and there's what's so beautiful about humming is that there's a sound with it, but it also resonates.
Yes.
And so you can feel it in your bones. And yeah, so this this isn't hypnosis, but it's very good. It's very useful. And before I forget, I do want to say that that film that I showed, Dancing with Pain, is freely available. And I have given the link already to Chip. Alicia, Efua, and the team have it. And so anybody who wants to look at the full 20 minutes, be in touch with Chip and they'll send you. It's on a private YouTube. So it's not out in the world. It's you do need to have the private link to be able to get it. Oh yeah, fabulous. There's
Perfect.
popping it into chat, and there's a little 3-minute trailer if you want to have a look at that. So yeah, back to dancing and neuroplasticity. So, Dr. Griffin, my question to you is, as a dancer and as a dance therapist and as a clinician, psychologist, pain specialist, what do you find about movement that helps neuroplasticity?
I think that we are tapping into a different part of our brain when we're dancing and moving. And one of the, I think one of the important things for young people to know about this also is that, when we're experiencing dance movement, we are actually using something different in our brain. We might not be able to walk across a room, but dance does actually tap into different parts of the brain. And when we're using that creativity, we are able to sometimes move with ease, even despite the experience of being in discomfort. And that is an incredible thing that I've seen over and over again with young people, even with conditions like complex regional pain syndrome, CRPS, where you can't put your foot on the ground. I have seen young people be able to dance and move in ways that's different than just walking across the room. And once we can do that in a creative way, we start making those steps forward and the brain starts to,
You can,
we're putting the pieces together and the building blocks together to be able to then walk across a room. So I have been fascinated and thrilled by what I've seen happen with dance
yeah,
and creative movement
yeah.
that is very different than sometimes just simple movement.
Like physio.
Yes.
Exactly. So in what you're saying, which I really want to underscore here, is that you're saying that creative dance, be it in a body stocking or be it in play or just lying on the floor and stretching in different
Mhm.
ways, can be a bridge
Yes.
and take you from the stuck place
Mhm.
into new possibilities. It's like opening a door.
Right. Yeah, going from stuck to flow, right? Being able to flow with ease and in fun ways. And we came up with the term, my crew of patients and we came up with the term that laughter is medicine. And sometimes dance and being silly with movement is like laughter really does actually help with the signals of pain. And if we can bring humor, if we can bring that creative, fun kind of experience, it can make a difference. And I'll give you an example of this. When one of the things I'm excited that I was able to be part of was create using virtual reality.
Yeah.
And again, another creative way of using movement. And my colleagues and I at Stanford, we were able to create something called Fruity Feet, which was a very silly video game that, you got to move your whole body around. And then there's another program called Tilt Brush, or now they call it Open Brush. And these are, free virtual reality applications if you have a VR system and you're able to draw three-dimensionally. And I think that that is kind of a way of creatively moving the body. Like, okay, I'm going to draw my happy place and I'm going to have it's my make-believe place and I have palm trees and so I draw these palm trees and I'm going to create an ocean and I'm going to put water over here and you can three-dimensionally see this. All of that creative movement
Yeah.
allows for us to not just bridge but actually move our body in the ways that help us become more like functional, which means that we can do things like we want to do, our regular everyday movements that we would like to be able to do. And it helps us to get to that quicker.
Yeah.
And there is something wonderful about being creative in virtual reality with movement and our creativity at the same time that we're tapping into a lot of these things we're talking about all together.
So sometimes we don't have those
No,
sophisticated.
right? But we can do it with our own imagination.
Yeah, exactly. So coming back to the little clip I showed
Mhm,
you, you have this smart, lovely
mhm,
teenager who had chronic regional pain syndrome, CRPS, who was visualizing that her and she was my patient. She just did phenomenally with just focusing because her one leg was functional and strong.
mhm.
Instead of focusing on the pain in the other, she created the right leg to be duplicated as the left.
Yeah.
And so could even be small movements, like in the tub, she was, bending, stretching, bending. And so that in itself was activating those new patterns, starting off to
Hmm.
bridge and create brain patterns that support normal movement, normal
Yes.
leg, normal sensation, normalizing.
Yeah.
And, the teenagers we've worked with over the years have
Mhm.
taught us so much. I'm so
They
grateful.
have. They've taught us. Like, I
Yeah.
remember learning from a young person that I worked with that said, that helped me to think of something in a very different way. I really like this idea that you're like, so almost like copy and paste, right? Like copy
Yeah.
the
Yeah.
good feeling over here and paste it. Remind the other limb what feeling good feels like. And I've even
True.
had some young people notice, like, I'm just going to focus on my earlobe because it's the only part of my body that feels okay, or my eyelash because it's the only part of my body, or the tip of my nose because it's the only place that feels okay right now. But okay is the feeling we want the rest of the body to remember.
And
And we
if you
can
start
focus
there,
on that.
you
Go ahead,
start,
Leora.
sorry, you start there and you just nourish it again.
Yes.
Remembering this key point in hypnosis that what you put your attention on gets amplified,
Yes.
grows. And
Yes.
when it grows, you're nourishing it. And as you nourish it, it grows bigger. And so you've always got that choice. And so look at what choices you're making and and go with the ones that are feeding you in the direction that you want to go to. So many things. And I've just
Yes.
looked at the clock and we
Yep.
have 3 minutes. You and I could chat for the next 2 hours, and we've got 3 minutes. So, what do we need to attend in this 3 minutes, Anya? What do
Well,
we?
I think I what would be helpful from my perspective is, we're talking about a lot of different things, and some of these things are advanced, but not so much. I
Mm,
really like this idea, and I'm going to revisit this idea of islands of comfort, and that we can start in the smallest of tiny little ways, and it
love it.
might be drawing, and it might be doing a breathing exercise, or it might be music, or it might be dancing, or it might be something else, playing a video game even, or being, like eating mindfully. It could be anything, and it could just be for a moment and just what we hear you saying, Dr. Kuttner, and then we grow it from there. But I wonder if you could just share one little thing about how do we begin with a tiny little island of comfort.
Oh, good. This is the first pause I think I've had because how, how do we go? E- Um, that's where the choice is. I'm choosing my present to be more comfortable than pain. I want, I opt for. I guess it's in a sense, we're looking for, grab that little molecule of hope.
Mm. Mm, yes.
If you grab the little molecule of hope, suck it in and 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 go there. That just enlivens and will there are that's it. Just in your being, you say, yes, it can be easier. It can be. And that's that little molecule of hope that
Yeah.
then feeds you to move, to breathe, to focus, to
Yes.
choose exactly what you want. What would you say?
I would say, listen, there are the doctors, there's all of your treatment team, physical therapists, psychologists, like so many people. But really, where I find the most important place to begin with comfort and hope is within yourself.
Inside, inside.
Inside. It's not the breathing exercise. It's not any of the things. It's what we choose to make the meaning for ourselves. Sort of what we talked about at the beginning. It's about finding what's the one small brief moment. What's the one part of the body that feels pretty okay right now, and bringing all of our awareness and attention to just that little moment. And if we can do that even for a split second, we can begin to grow it from there. And that's what
Yes.
I learned for my own pain management. And I learned something from each of the patients that I worked with. And that's what I see for everyone. It's just they catch the molecule and they
Yeah.
just allow it to be okay for just that brief second. And then they go from there. And everyone can find a split second of that hopefulness,
Absolutely.
of that comfort, and we can grow from there.
Always, always. Absolutely. Oh, gosh, I think we should ask
Yes, our moderator.
our host whether there are
Shine to
any
come and join
questions
us.
for us. And hi,
And please
Vishnav.
introduce yourself so everyone knows who you are.
Yes, for sure. And I wanted to take just a moment before that to really thank you both, Dr. Griffin and Dr. Kuttner. Not only are you both such industry experts and leaders with such a wealth of knowledge, but I think your passion and your compassion towards pediatric patients in pain is so evident in how you consider them and in your responses. So thank you truly for the opportunity to learn from your expertise today. And to all of our wonderful audience members, my name is Vaishnavi. I'm one of the fellows here at CHIP. I also, as someone who has chronic migraines and a younger patient who deals with chronic pain, this conversation about healing, creative healing, and nervous system regulation is especially meaningful to me. So I definitely wanted to kick off some questions on behalf of our audience. One thing that really comes to my mind first and foremost as I'm hearing you both speak, Dr. Griffin, Dr. Kuttner, is in your experience, do you believe or do you see that pediatric patients express and process pain differently than their adult counterparts? And if that is the case, do you think this makes them more suited for hypnosis-based healing?
Mm, I love
Hypnosis
that question.
suitable for everyone, honey. From little ones, the youngest that I've worked with via their parents was 10 months, where we had rhythm and blowing and hypnosis is relevant through the whole lifespan.
Mhm.
Here's the important thing about adults with chronic pain. They were probably teenagers with chronic pain who didn't get help from CHIP, help from their pain team, sufficient help to heal sufficiently. And so that's part of why um, we have been so dedicated to teens and helping them now so that they can work through it and have adult lives that are relatively free from the burden they carried as teenagers. And, you know, there are more individual differences than I think uh, differences between adult and teen. The key thing for me in terms of using hypnosis is motivation.
Mhm.
Are you open? Would you be curious to go into your imagination and activate the healing and develop your skill, your inward creativity to expedite, to accelerate your healing, because that's what hypnosis offers.
There is one thing I will say about the difference of um, kids, youth, kids and teens versus adults is that sometimes, well, not sometimes, this is a fact that the brain is still, we called it, we heard this word neuroplasticity, but it's still flexible. The brain is still developing when you're a young person. And so I find that change sometimes is a little bit easier. Using imagination is a little bit easier. And sometimes when we become adults, we're a little more fixed in our way of thinking.
Good point. It's
And
true.
and sometimes that makes things maybe a little tougher for adults to be able to find their way to be able to change. It's not impossible. It's just that I think we heard Dr. Kuttner use the word motivation. And I think that young people have much more flexibility to think creatively. And I do think creativity is a very big, important part of a healing process. So it's, I've had older teenagers tell me, why is it that the kids under the age of 11 seem to get better a lot faster? And a lot of times it's what we believe we're capable of is a part of this. And a younger person might say, oh, okay, I can use my creativity and I can use my breathing exercise, I can use my hypnosis. And as we get older, sometimes we don't necessarily believe that those things are possible. So, what we believe about what is our own ability to help ourselves heal sometimes, can sway it one way or the other. Dr. Kuttner, I
Yeah.
wasn't sure if that
It's no, it's spot
resonates for you.
It totally resonates for me. That's spot on. It's belief systems, the stories. We've made a
Back to
whole
stories. Yeah.
The stories we tell ourselves can be for better or for worse.
Mhm.
And you know, I do totally agree with you about teenagers having less baggage, so they
Mhm.
freer to get into the newness. They're more adaptable. Um, and that's, you know, adults are can be helped absolutely, depending on their motivation, but
Mhm.
teens and young people and
Mhm.
kids are a lot more responsive more
Yeah.
quickly.
Mhm.
I would say that.
I think that segues actually really beautifully into one of our next questions, which is we talk a lot about, or we've heard a lot about belief systems and, changing the pathways. And but what about the teens or the youth that are struggling to accept kind of
Mhm.
their reality, or they're maybe resistant to trying these healing pathways, or they think that they've tried a lot of things and they're not seeing any comfort? So how would you
Sure.
recommend for these teens or these young adults that are facing this lack of optimism, that are facing this
Mhm.
resistance to healing?
Yes, we I've I don't think I've had a patient where we haven't had some of that. And they
Yeah.
usually don't get to me until they've tried everything else. And so I think it's important that we validate that first, right? Like we have to validate one's lived experience, one's story. Because so many times I think there's been invalidation, like, oh, that's not important, but it is important. One story is important. And oftentimes I will share what my own experience was with pain. And that's a real story I shared about how I learned about islands of comfort. That it does feel like I've tried these breathing exercises, I've tried medicine, like nothing's working. And there is a lot of power that our belief actually has. And that's what you hear Dr. Kuttner and I saying in different ways, but over and over again. And the story that we're saying about what's going on, our body does listen to.
Yeah.
Our body helps to create the story too, right? It's what we're experiencing. And we can sort of like when a computer's not working, we can like, no, we can just override this. We can turn this part of the program off, bless you. But what we can begin to do is reprogram some of this story or belief. And we've given lots of examples of how we can do that. Sometimes the reason why creativity, which is why I think Dr. Zeltzer was brilliant in creating CHIP, is because creativity does allow us a little bit of that ability to override the message, override the story that we're telling. And we can create, literally create something new, something from scratch. And if we can tap into creativity, no matter what kind of creativity you're using, that can actually be the pathway forward through what feels like nothing else has actually helped at all. And I've seen
Yes.
it happen more than any other way.
Yeah. And so that's again where hypnosis enters, because it's not a structured artifice. It's a creative process that draws on inner imaginings, inner experiences, and it's a spontaneous uh, kind of not, it's a spontaneous yeah, internal transformative experience.
Hmm. Hmm.
And so um having an experience with hypnosis can be a breakthrough for
Yeah.
somebody who has had lots of disappointments. And mindfulness is useful, but mindfulness is not, it's a practice. It's a
Hmm.
wonderful, non-judgmental, secular, spiritual kind of practice about being in the moment and not full of judgment, and but it doesn't have the goal that hypnosis has, and it doesn't have when you do hypnosis, you're with a clinician who does not close her eyes or his eyes and works with you to guide you to the transformation. 2 days ago, I was working with a young man who had extreme needle phobia, and he had to have needles. And and as we were working, he had said to me, I hate the feeling of knowing in my mind that there is this steel thing in my vein. I hate it. I hate it. I hate it. And I said to him, so we went into the hypnotic trance. And I said, it's, how everything is so cold, that needle, as soon as it touches your skin, becomes an icicle and it melts. And it melts as it delivers the medicine. And he worked with that hypnotic transformation, that it was an icicle and it melted and it made everything cold, cold, cold. And it was liquid just flowing into his hand and giving him the magic medicine that was healing him, that was doing him a lot of good. And he had had this for a number of years. And one session, I got a text from him saying, it worked. I did it. It was cold, 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 just like ice. And I am so relieved. So we come back to the importance of hypnosis, about the infinite creativity of working with a trained clinician who will lead you into ways to transform back into making life easier, making it more manageable, activating the healing so that you can live your full potential with creativity, with gusto, with energy, and with hope. Yeah.
We can clearly hear so much more from your expertise and your insight, and hearing these examples, I think, teaches us so much about the power of your brain and the power of believing, and the power of neuroplasticity. And I think the last question to end on is probably a good one to wrap the entire conversation together, and it is also from our audience. I think we have a couple of questions that came in that kind of asked about what is it for teens, for young adults, for patients that are having chronic pain. What is one thing you hope for them to take away, or what is something that you think that they can really learn from today's discussion about healing and finding that molecule of hope?
I think there's a lot I could say about finding the molecule of hope. Um, and I do, like I saw, I was looking at the Q&A a little bit, and yes, do I think that a clinician can be helpful? Absolutely. Do I recommend pediatric psychologists that have specialization in pain management? Absolutely. Would I recommend one that has training in hypnosis as well? Absolutely. And because they're if you're really struggling on your own, you don't have to be alone in this. You could be working with someone that can help you find professional hope molecule finders, discover people helping you to discover what direction is right for you. And I think, sometimes you work with someone and it doesn't work out and you feel like, yeah, this person's not helping me find this hope molecule. Then let's help you find someone else.
Exactly.
Because it is important to have someone who can help coach you and guide you along the path so that you can start to make those discoveries yourself. Because I think it's really within each of us to find a path forward and someone who can help to guide us along that path forward. Dr. Kuttner?
And so the only thing I'd add to that eloquent and important statement is, and so trust yourself. Trust yourself to know, does this feel right? Do I want this person? Do I want this treatment? Even if it's hard, but does it feel right? Is this opening a door and developing my neuroplasticity and helping me make progress? Yeah, that's the only final thing I would add. It's crucial. Come home to yourself. Take that breath, trust yourself, and know there's always more. There's always hope. And it comes in many, many different molecules. Yeah.
Wow. Woo. If you're like me and you're just sitting here and you're like, I just need to take a deep breath after just so much wisdom. Take that deep breath now. So let's, on a count of three, let's all take a deep breath together. 1, 2, 3. Such a beautiful conversation. Thank you so much, Dr. Anya Griffin, Dr. Leora Kuttner, Fashion Nabi, Efwa, Ira from our team, for Dr. Lonnie Zeltzer, for an amazing webinar. I didn't even know what to say. I'm speechless. It was so good. And so one of the things that I will close with is I am the executive director of CHIP, Creative Healing for Youth in Pain. And they did so many things that I think just segues us into something exciting happening this summer for young people to move, to tap into that creative healing. And that is our virtual online summer program happening July 13th to July 24th, where you will have some great facilitators for your young people, 13 to 18, and they will get to experience many of the things that was talked about in this session today: creativity and creative healing. So if you get a moment, please log on. It's in the chat to our summer website. Sign your children up. We are not full, plenty of space. And if you also get a moment, if this moves you in such a great way, please donate today. $25, donate to CHIP. And that link is also in our Dropbox chat. Thank you so much. Have a great day. Let's stay on.
Okay.
Bye, everyone.
Bye-bye. Go well. Have fun. Creative fun.